Hey, my name is Adam. I am a doctor of physical therapy and am in my final year of medical school for my MD. Now let's talk shoulder pain. Shoulder impingement is the most common cause of shoulder pain in the United States and will typically show up with pain that gradually onsets over weeks or months. It's not normally something that you just suddenly wake up and snap, you have it. The condition also has many other names: subacromial pain syndrome, rotator cuff related pain syndrome, and a wide variety. All refer to the same thing, and this just comes back to a little bit of debate as to what exactly is going on in this condition. The pain typically shows up as pain either loosely right over here on kind of the edge of the shoulder, maybe up front, and also very often radiating down the arm right about here. And that's commonly mistaken as being deltoid related pain, but in fact it's just referred pain from the shoulder and a little deeper in. Pain with this condition is most often seen when we raise the arm up, in particular from about this range of motion here up to loosely around here, either on the way up or on the way down. The second time when people tend to experience it the most is when bringing the arm across the body. So again, say it's this shoulder, if I reach over here and say try and grab something here, help get dressed, then I may experience that pain. Now, the reason why these positions are particularly provocative will make sense here in a second with some visuals of the theory of what might be going on. Shown here is the shoulder joint, which is formed of the ball of the upper arm bone or the humerus, which rests into a cup that is shaped and formed by the shoulder blade or scapula, and you can see that wrapping around the side a bit. Now, up above that ball, you also see a bony ledge that is formed from the shoulder blade. And as shown over on the left, the red things or muscles are the rotator cuff, and those muscles run up through the space between that ball and that bony ledge to connect over onto the humerus or that ball of the upper arm bone. Now, when we go and raise our arm up to the side, as I showed earlier, or when we go and bring the arm across the body, we narrow the space in that bony tunnel. Traditionally, it was thought that this is why we have pain, because we impinge the rotator cuff muscles. Now again, that's a little bit more in debate these days, so I think it's more simple to just think of it as the shoulder is sensitive to this increased compressive position, which is why we get pain in those positions. The specific tissue implicated is a little more in debate. The question then becomes, why is our problem just now arising? And I think an easy way to conceptualize it is essentially we're doing more than our body can readily tolerate or readily recover from. Now, grossly, I think there's two big categories we can break this down into. The first one is shown on the left, and that's the person that's chronically doing too much, like a CrossFitter, a weightlifter, whatever. So the blue box represents what our body can readily take. The red box is how far over that we're going. So if we're constantly beating ourselves up too much in the gym, eventually it gets aggravated and we can't take it very well anymore. On the flip side, the one that often sneaks up to us is the one on the right, where maybe we're doing about the same amount as we normally have, but now it's starting to be a problem. Often this is someone that's become more deconditioned, has aged, or has some other health conditions going on, which has brought their baseline of what they can tolerate and recover from down below what it is that they're doing regularly on a day-to-day basis. And so we're going to come back to this concept in a little bit to talk about how we approach rehab. But first, let's talk how long you should expect recovery to take. So if we look at the research, what we see for shoulder pain just in general is that at 3 years out from symptom onset, 54% of people still have some degree of persistent symptom. It's important to note, though, that persistent symptoms is subjective, right? It doesn't mean that, say, right now I can't lift my shoulder because it hurts so bad, that 3 years out from now I'm still going to have that problem. What persistent symptoms may mean is that every few months when I go out and do more yard work than normal, my shoulder's a little achy and a little uncomfortable for a couple days. But for the most part, throughout most of the year, it's better. It's just important to keep in mind, because it doesn't mean if we do this one simple exercise, as the internet often claims, that you'll be fixed and cured. And it's also likely to be a longer process than you think. Looking at shoulder impingement specifically, 60% of individuals with this condition get what they consider acceptable amounts of relief from a combination of NSAIDs, so like ibuprofen, physical therapy, and steroid injections. This is not counting people that go and get any kind of surgical management. That does mean that there's a good chance we can improve to a degree that we're happy with. But it does mean that It's not going to be quick because, again, this is 2 years and this is 3 years. We may still have some kind of residual issues moving in the future. It's just important to keep those things in mind. Now, on that long path to recovery, I think it's important to note that it won't look like this. We won't get better really fast and then kind of plateau out. Instead, what it's going to look like is something a little bit more like this. Now, what we see here is that overall we are trending up, but some weeks or some months we get more improvement than others. We also have times, like highlighted at the arrow here, where we seem to regress and do worse than we did the week before. But overall, our trend is still upward when we look on a wider time scale. An easy way to conceptualize this, I think, is if we think about knee pain. Let's say you have pain going up a flight of stairs. Right now you get pain on step 4. You won't notice when you get to step 6 without pain. You will probably only notice when you go all 10 steps before experiencing pain, but you were still improving before that point in time. So what can we do to get better? Now, there's a lot of things we'll talk about like exercises, but the biggest core overarching concept comes back to the same slide. What we saw earlier is our biggest issue right now is we are in the red, meaning we're exceeding what our body can readily take or recover from. So the first thing we want to do is try and bring down what we're doing so that it's down below the blue and below what our body can readily take. And our goal with PT exercises and other things is to over time build up what we can take, so build up that blue bar so that it's up higher than what we want to do on a day-to-day basis. This is done by adjusting the 4 variables shown here. If you're a weightlifter or a CrossFitter, this is really intuitive and you probably get it. But if not, it gets a little more confusing if we're talking about someone just going around doing their daily activities. So one way to think of it here is with load, say how heavy the plates or how heavy the boxes you're lifting overhead are. Volume is how many total plates or how many total boxes you're lifting. Frequency is how often are you doing it. Is it every day? Is it every other day? Is it every 3 days? And duration, how long you're doing it at once. Are you doing chores continuously for 2 hours? Are you doing them continuously for 10 minutes? The most intuitive one to adjust is load or weight, but it's not always feasible. So if not, we can look at changing something else up. For example, frequency. Say we do chores every day currently. Maybe we change it down to every other day instead. Maybe that's not feasible either. Then we can do some combination of changing multiple variables. Like say we go to every 3rd day off. We also change the volume. So maybe instead of reaching overhead 100 times, we do it 70. Instead of duration being 2 hours at a time, maybe we drop it down to 1 hour. The important thing is just that we find some level of adjustment we can make to bring our pain levels down to a tolerable level. And then over time, we increase those variables back up as our pain allows. We can also make some temporary movement and posture modifications to help reduce that overall load. In a moment, I'm going to show a video with a way you can change how you reach overhead and how you sleep if you have pain while sleeping. Try this out. Instead of reaching with your palm facing down, which increases the compression in the joint, try the reach with your thumb pointing up and your palm out to the side and see if it helps. This is temporary while the shoulder calms down. As for exercises, there's an endless number we can do, but it's important to have some combination of an overhead option, a rotator cuff strength option, and a shoulder blade strengthening exercise. I'm going to show 2 options for each, one that's easier and one that's a little harder. Here's the 2 options for reaching overhead. I would normally start with the exercise on the left, and that especially goes if we're experiencing a lot of pain. The reason for that is that by placing our arms on the wall, we essentially offload the shoulder and reduce how much weight or how much resistance it has to fight when going up overhead. Now, as that gets easy, we can progress onto an exercise like on the right. We don't necessarily need to use resistance bands. We can use that, we can use weight, or we can use something else from around the house for some form of resistance. Here's the rotator cuff options. Again, the left one is easier, the right one is harder. However, you can adjust the intensity of either of these pretty easy by changing the resistance of the band or the amount of the weight placed in the hand. Finally, here are the shoulder blade strengthening exercises. Again, the left is easier, the right is more challenging. Now, if the right is too hard, you can also do it without weight. You can also consider bending the elbows to make it easier as well, and just progressing as you can tolerate. As for the number of sets and reps, that's going to depend quite a bit by the person because it depends how much you can do while feeling like you can recover appropriately and without flaring up your pain even more. A good rule of thumb for most people, though, is to aim for 2 to 3 sets of 8 to 15 repetitions and try and start out doing it every other day. If that feels too easy, you can do more. If too hard, you can back off. Next, let's go ahead and talk about medication options. In terms of medication, unfortunately, we don't have any easy fix. We have 3-ish options that we can choose from. So first, in the place we'll typically start is with an NSAID, so non-steroidal anti-inflammatory like ibuprofen, or potentially some other options that may be prescribed to you that are still within that class. We do have to watch out with this if we have kidney issues, certain heart issues, blood pressure issues, or issues with bleeding. If that's the case, then we may want to go look at topical agents like Voltaren gel or diclofenac gel, because we just place it over the shoulder, it doesn't get absorbed quite the same way and shouldn't stress those organs as much. Now, if that doesn't work, then what we can look at doing beyond that is potentially Tylenol, so acetaminophen, or potentially a combination agent of both Tylenol and also tramadol. Tramadol is essentially a really weak opioid agent. Now, opioids themselves are generally not utilized in treatment of this condition. Let's say we've gone and tried medications and physical therapy and we're still not having a lot of luck. What are our options as our next step before surgery? We have several. The most common one that you're going to encounter is the option of a steroid injection into the shoulder. Now, an important thing to know though is that does not come without some risk. In particular, if we repeat the shoulder injection multiple times, we have a risk of weakening the tendons of the rotator cuff muscles and potentially increasing our risk of a rotator cuff tear long term. Other injections are also available like PRP and various other regenerative medicine injections. Worth noting though is these are still relatively new injections, and so the research and the data on their effectiveness is still not fully clear. Say we've tried all these other things and it's not working. What are our surgical options? Historically, the option is to go in and do a shoulder scope, where essentially what they do is they go in, they find that bony ledge that was shown earlier, and they essentially shave off part of it to try and increase the amount of space between that ball of the humerus or upper arm bone and that bony ledge so that things don't get pinched or impinged quite as much in there. Now, going back to what I said about it not being clear what exactly is happening in this condition, we have seen from kind of a lot of data at this point that that procedure, that surgery, is not more effective than physical therapy at a wider time scale. In fact, there's even studies where they did a sham surgery, meaning they put someone under anesthesia, put an incision in place, but did not actually go in and shave off or do anything. And the outcomes were just as good as actually going in and doing the surgery. So for this, among other reasons, there's currently a shift away from doing that procedure in medical practice. It may still be offered at certain times to certain individuals, depending though. As for any kind of surgical option outside of that, that's going to vary a lot on the individual, because it depends on your age, your other health conditions, the state of your joint, like how much arthritis there is, and also the state of your rotator cuff, like is it torn, is it weak? So that has to be something that's more of a one-on-one discussion with your surgeon to see what, if any, surgical options are at play for you. So in the end, here's a lot of the key points that came up in this video. I hope they made sense to you. I hoped it helped, and good luck. I hope things improve for you. Thanks for taking the time to watch this video.